The White House declaring monkeypox a public health emergency. The move frees up money for vaccines, treatment, and prevention.
We're prepared to take our response to the next level in addressing this virus, and we urge every American to take monkeypox seriously and to take responsibility to help us tackle this virus.
As of today, the U.S. has distributed 600,000 of the more than 1 million available doses of the Jynneos vaccine. Officials say there are now enough tests for about 80,000 people a week. The CDC confirms almost 7,000 cases of monkeypox here in the U.S. That's up from less than 5,000 last week. New York has the most cases, followed by California. Illinois rounds out the top three with 547 cases.
And here in Chicago, health officials gave an update on the city's response to prevent and treat monkeypox infections.
WGN's Andrea Medina is live at City Hall with more on that. Andrea?
Hi, Dina and Ray. Health experts are stressing the importance of education, avoiding skin-to-skin contact, and getting vaccinated to control the spread of the virus. More than 6,000 monkeypox cases have been reported across the country. On Thursday, the Biden administration declared the outbreak a national health emergency, a move Chicago Department of Public Health Commissioner Dr. Allison Arwady says will accelerate vaccine distribution.
Similar to what we've seen in COVID, where we've been able to really see more vaccines move more quickly, I'm also hopeful we may see some more flexibility in funding.
During a news conference, several health experts detailed their efforts to combat the spread of the virus across the Windy City.
I really want to emphasize that there is vaccine available no matter where you live. There is testing available no matter where you live.
In Chicago, 55 of its 77 neighborhoods have been affected by the outbreak.
About 47% of our cases have been diagnosed in white non-Latinx Chicagoans, about 14% in black non-Latinx Chicagoans, and about 31% in Latinx Chicagoans, 4% in Asian Chicagoans.
The Wellness Home has made their office a one-stop shop to help create accessibility and lower barriers among black and brown communities.
At the location of Halstead, we have created a monkeypox mini center. And in that center, we do testing, we do vaccinations, and we do assessments.
There have been 459 confirmed cases. 21 people have been hospitalized.
The overall risk of MPV to the general public remains low at this time. But we really want to emphasize that we need you to see a healthcare provider if you develop symptoms.
Skin-to-skin contact like kissing, hugging, and sex are common ways the virus spreads. It has mostly been detected among gay and bisexual men.
I want to emphasize that there is nothing biologic about this virus that makes it specific to men who have sex with men. However, that is the network where we have been seeing it spread the most here in Chicago and around the world.
With Market Days, an LGBTQ-centered street festival happening this weekend in North Halstead, health and community leaders have been warning festival goers how to avoid getting the disease.
What we've done is we created an education campaign. Our businesses in the community have come together. We're showing videos in our businesses, and there's material literally everywhere on North Halstead and throughout the community about monkeypox.
Virus symptoms range from fever, aches, and rashes. If you're not feeling well, health experts say isolate yourself and get tested. And as of right now, monkeypox cases in Chicago have only been detected among adults, and there hasn't been any deaths. Now, the health commissioner says vaccine supply is still limited even after receiving 13,000 vaccines yesterday. But she does say that they're expecting another shipment of 20,000 vaccines in the next few weeks. We're live in the loop. Andrea Medina, WGN News.
Thank you, Andrea.